Talk!
This project was produced on June 20th, 2019 in Winchester, Virginia by Stacey McGowie, Kathleen Scabelli, Brittany McDaniel, Jessica Staples, Courtney Bendig, and Carly Straight. The German healthcare system was the first universal healthcare system developed and has now reached a level of almost 100% coverage of their citizens. Here's a brief description of how the system evolved to where it is today.
The German healthcare system was first established in 1883 with the construct of skilled craftsmen paying into a common fund for the purpose of helping with sick individuals' medical fees. At this time, only approximately 10% of the German population was insured. The following year, the Bismarck system was instituted, named after the Prussian Chancellor Otto von Bismarck, that embodied the first construct of statutory social health insurance. Under this system, the elderly, the disabled, and those requiring skilled nursing were provided federal coverage. In the early 20th century, another key component of social welfare was added to the German healthcare system, which included coverage for the unemployed, and it wasn't until the latter part of this century that insurance for long-term nursing and assistance was incorporated into this system. In 2007, the German government mandated that every citizen be covered with health insurance, either through statutory government programs or by private insurers. Today, nearly 100% of citizens are insured using this universal multi-payer system.
The German healthcare system is based on 4 basic principles. The first principle is compulsory insurance. This means that all German citizens are required to have insurance. If their income level is below a certain threshold, they get statutory health insurance offered by the country. But if they are above that threshold, then they have the option to purchase private insurance. Secondly, funding through insurance premium is paid for by both employers and employees. Premiums paid are based on income, and there are additional funds that come from tax revenue surpluses. The third principle of solidarity means that all Germans consider everybody who is covered by the statutory insurance, regardless of the premium paid, to have equal right to medical care. Based on how their healthcare system is set up, citizens jointly carry costs of medical care in the event of individual illnesses or traumas. Finally, we have the principle of self-governance, which means that government sets conditions of medical care, but the organizations and financing of medical services is left up to self-governing bodies of the healthcare system.
The current system is a universal multi-payer dual system with both public and private health insurance options. Health insurance is mandatory. Most people opt for compulsory insurance provided by the government, but some have the option to enroll in private insurance plans as well. Under compulsory insurance plans, everyone has access to the same basic benefits, which include inpatient care, outpatient care, and basic dental care. The cost depends on your income, and you can register with any of the 110 Krankenkassen, which are nonprofit associations administering the government health scheme. Employers usually organize insurance plans for employees, but you can also choose your own. The government regulates minimum benefits offered, but the plans have different premiums and varying supplemental packages, so it is best to choose your own if you have certain things you want covered. Private insurance plans are optional and available to purchase for officials, those who are self-employed, and those making over 52,000 euros per year. The private insurance market is served by about 40 different companies. These plans charge per person, whereas public insurance plans automatically cover dependents in the same household. Cost of private insurance is based on the benefits chosen, patient age, and pre-existing conditions. Private plans cover items not covered by compulsory insurance, such as private doctors, hospital rooms, or vision services, and can be purchased alone or combined with compulsory plans for full coverage. Roles within the system. The Federal Ministry of Health is responsible for policymaking at the federal level. It directs institutions responsible for dealing with different issues of public health. Some examples include the Federal Institute for Drugs and Medical Devices, which approves pharmaceuticals, and the Paul Ehrlich Institute, which approves vaccines. The Federal Joint Committee has members representing doctors, statutory insurers, hospitals, and patients, and is responsible for decisions regarding compulsory insurance and quality assurance. It analyzes data and uses results to make decisions concerning healthcare, and is the highest form of self-governance in the system. The Association of Statutory Insurance Physicians includes all physicians who bill services to statutory insurers. Doctors are self-employed but must have a statutory health insurance accreditation to provide outpatient care. All doctors must be members of their respective individual state physician chambers. These serve to supervise professional obligations, oversee medical board examinations, and resolve medical malpractice claims. Doctors' own professional interests are represented by physician organizations.
In this table are several measures of health dictated by the World Health Organization. U.S. statistics have been incorporated to generate context and perspective. Of special note, there is a large difference in total expenditure of health based on each nation's gross domestic product. It is interesting to note that despite the U.S. spending more on healthcare, it falls short in all health measures provided here.
When compared to the U.S. healthcare system, the system in place by Germany has many strengths and weaknesses. Its strengths include the fact that every citizen and permanent resident is required to have insurance. The system is funded through insurance premiums paid off of income levels, which help keep costs down. There is management of the cost so that when volume supply increases, the cost can come down since it's not a capitalist market like the U.S. There is also a much lower rate of medical, lab, and medication errors compared to the United States. Overall, public surveys show that the majority of Germans are very satisfied with their healthcare system. However, the system in Germany does have its weaknesses as well. Technology is not as advanced or available to patients when it comes to therapy, diagnosis, and surgery. Except for CT scanners, the amount of technology per patient population is much less than the US. The system itself is considered to be more inefficient since there is nothing that limits the demand of the patients or the supply of the providers, which has many specialists doubting whether it is a system that can remain cost-effective in the long term. Germans see their physicians far more frequently than the US, are admitted more frequently to the hospital. Hospital stays are the average of 12 days as opposed to the US being at 7 days, and more prescriptions are given out.
In the U.S., emergency rooms are filled with people who lack insurance seeking care for even minor conditions due to lack of access to a provider. The ER is mandated to see all patients regardless of insurance, but this causes a huge financial burden and uses up unnecessary resources. Because everyone has health care, one of Germany's strengths, their citizens have access to a primary care provider and specialists and do not have to utilize their ER as often in the U.S. The healthcare quality and access is based on amenable mortality and uses age-standardized and risk-standardized mortality rates, which could have been prevented by timely and effective healthcare. The index is from 1 to 100, with 100 indicating lower mortality rates and thus better quality of and access to healthcare. As you can see, Germany had a ranking of 92 in 2016, while the U.S. was at 88.7, showing that there were less preventable deaths due to a stronger healthcare system. Here we can see the vast difference between Germany and the U.S. in the contrast between a nation where the citizens have full access to healthcare and a nation where many Americans are uninsured. There is a 26% difference in the access to healthcare, with Germans having a huge advantage over Americans with their system.
Public perception of healthcare in Germany differs vastly from the American perspective. In Germany, healthcare is considered to be a right that all are afforded. To quote Handelsblatt today, a German business newspaper, in Germany, health insurance is not a partisan football, referring to the political climate that sometimes hinders healthcare and insurance advancement in the United States. This no man left behind mindset is evident in the semantics of how contribution to sickness funds or the public insurance occurs. As of 2017, funds are capped at 7.3% for all employees, meaning this percentage of each individual's paycheck enters the pot. The patient's employer contributes the same percentage, and this percent is also fixed for all employees within Germany, but it is based on each individual's salary. Among some of the most noteworthy reasons why Germans value their healthcare include ability to choose providers, much like how our PPO system functions, that is, without a network with constraints. Additionally, citizens can reach physicians after business hours utilizing a central line, though this does not replace the concept of emergency rooms, which are present in Germany. With the current statutory system, there are no deductibles prior to coverage of medical services. So from the first visit or service needed, Germans are not paying out of pocket except for copays.
Since 1883, when the German healthcare system was put in place, the Germans have made it their mission to tend to those less fortunate that may be poor, ill, or disabled. From craftsmen putting aside some of their funds, to the current system where premiums are based upon income, their system is set up in an efficient way that all citizens will have insurance and have equal access to health care, regardless of their social status. Medical costs are shared jointly by all people, creating a strong system as well as a strong nation. While the German population may be smaller than the United States, their system allows less healthcare-related spending per capita, greater access to care for all citizens, high access and quality index rating, higher life expectancy, lower infant and mother mortality rate, and overall satisfaction by the people.
Auf Wiedersehen!